Hello and welcome to the France 24 interview. I'm Annette Young. As the world faces the biggest public health crisis seen in a century, all attention is now not only being turned on developing a vaccine to fight the coronavirus, but also finding the right medicine to effectively treat symptoms. Research is looking into whether the drugs chloroquine and hydroxychloroquine could be used effectively, the two already being approved for malaria, lupus and rheumatoid arthritis. It also follows encouraging early results here in France and China. Now, the French drug maker Sanofi says it's ready to offer the French government millions of doses of hydroxychloroquine. Joining me now is Olivier Bogillot, the president of the French Federation of Healthcare Industry, and who's also happens to be the president of Sanofi France, that pharmaceutical firm. Thank you so much for your time. France is in dire need of masks, not just for doctors and nurses, but also in many other sectors of activity. Production having already been increased, and the government says it's currently at 6 million a week. But medical unions are saying it takes 15 million masks a day to be needed. So what do we need to do in order to fix this problem?
First of all, I want to say that the healthcare industry is totally engaged and mobilized in this crisis. The pharma industries, the medical device industries, the digital health industry are working hard to find solutions for patients. Regarding the mask situation, we have to acknowledge that there is a big gap in France. My wife is a physician and she does not have any mask to work, which is a big problem. So we need to fix that. I know that the government is working hard to find a solution. Ordering masks in the other countries, but also I have to say that some other companies in France, such as textiles, working to find solution. I got a call this morning from one of my friends telling me that they are working to find solution to produce masks in France.
We also sorely lack other protective equipment and swabs that are used for tests. This despite assurances back in January that the government was well prepared. So how is it that we're at this point in time where clearly people are lacking resources?
I think that the wave was a little bit underestimated, and now when I talk to the hospitals, they have to find solution to get the goods they need. Actually, once again, I have to say that the pharma industry, the medical industry is working hard with them. I got a discussion the last couple of days with hospitals to provide them with the goods they need. There is a strong mobilization of our industry to find solution. But you're right. It's first a question of speed, and the question of finding the right ones in the chains to give this good they need.
I'm just curious to know, though, that this virus first emerged as a major health threat in China, more than 2 months ago. So why has industry not responded quicker here in France, the way it did, for instance, in South Korea?
I think we are doing the job. I mean, if you think about the pharma industry or the medical device industry, my team in Sanofi is working every day since for weeks to ship drugs in the hospital every day. Today, my team sent hydroxychloroquine to most of the hospitals that order it. So it's saying that we were not well enough prepared in the healthcare system, that's probably true. Saying that the pharma industry or the healthcare industry was not prepared is probably not so true. Today we are working hard and we are doing the job. There's no shortages.
And regarding diagnostic tests, the countries that are doing the best in terms of keeping the numbers down and certainly their death rates being lower, they do a lot of tests. Now, here in France, that's not the case. We do less. So even if we do speed up production of testing kits, how long would it take before we would be up to speed?
I think here again, it was a question of organization within the healthcare system. In other countries, you have more people trained to do the test for people, even in the car, and get the sample and be able to practice and do the test. It's not the case in France. The strategy was different. It was to welcome the patient at the hospital and then do the test at the hospital and have the right orientation of the people. The future will let us know if it was the right thing to do. Probably in the coming weeks, we have to think about doing other tests to make sure that we can let the people go and work maybe with more confidence, because knowing that they are not contaminated.
We also hear concerns about the lack of respirators. How can we increase and again speed up production?
Actually, we are working hard in the healthcare industry sector. We have a big player in France producing some respiratory machine. We have increased the production by 2, by 3, and probably in 2 months by 4. The Minister of Health just did a big order of respiratory machines, so we are increasing the rhythm of production. But, I have to say that it's not only the machine by itself. All the chain of subcontractors has to be engaged and mobilized, because a machine is not only a machine. You have filters, you have syringes next to the machine. All the lines, all the subcontractors have to be ready to answer when there is a request to increase the production. Now, I think that we are on the right track to get there.
Now, we've seen in recent days the luxury company LVMH has started manufacturing hand sanitizer gel instead of perfumes, the car company Ferrari wanting to help make respirators. Are there other industries who can convert very quickly to lend a helping hand?
Yeah, it's already the case. I can tell you, even before LVMH, we had discussions with hospitals. Most of the hospitals called me actually as a president of the healthcare industry sector and asked me for help. And I can tell you that some manufacturers have started to switch their lines to produce some hydroalcoholic, liquid, and we have increased the production to help the hospital. LVMH is a big player, and we have to thank them. What they did is amazing, because the production is huge. What they produce is huge.
And a question for you, because this is hard not to ask you as the president of Sanofi France. Promising tests have been carried out here in the country with your hydroxychloroquine drug, also called Plaquenil. A larger study does need to be carried out. How long will that take? And if it works, what are your production capacities?
So actually, you're right. There was a small study at this stage. It's very preliminary. We have to acknowledge that, but the results are pretty promising. So we have expanded the number of centers to test the efficacy of Plaquenil. As we speak, we are shipping in this hospital some boxes, so we can test immediately. We will start probably tomorrow to give the drug to the patients. Probably we will have results in the coming weeks. Once we have the results, we will be in a position to produce and deliver a huge number of those. I hope, as you and probably most of the people listening to us, that Plaquenil will be effective enough and we will treat and save some people.
Olivier, given what you've just been telling me, and it's still very much early days yet, but what lessons will your industry learn from this pandemic?
It's a pretty good question. I think that we have to think in the future about sovereignty, at least in Europe, because we consider that locate most of our production elsewhere was a good solution because we had a lot of pressure from the healthcare system to reduce the price. And actually, this crisis showed that it was probably not the right thing to do. Actually, in Sanofi, we did the opposite. We keep most of our production in Europe. Sometimes it was tough for us because we had to consider that the price were pretty limited for us and the production cost high in Europe. In the future, we have to change the rules. When you produce in Europe, you have to be rewarded.
Olivier Bogillot, thank you so much for your time. And that's it for the France 24 interview. Do stay with us because there'll be more news and headlines coming up very shortly.